And good evening, everybody. My name is Stacy Cruz, and I am the Strategic Programs Manager here at Fear Free. Thank you to everyone joining us here tonight for Low Stress Curbside Service, brought to you by Ceva Animal Health. Presenting today is Valarie Tynes, DVM, diplomat of the American College of Veterinary Behavior, diplomat of the American College of Animal Welfare, and we are so excited to have her here presenting for us this evening. If you have any questions during the webinar, please be sure to enter them into the Q&A box at the bottom of your Zoom screen. We will have a Q&A session at the end of the presentation. Like I mentioned, we are so excited to have you here tonight, Dr. Tynes. So on that note, go ahead and take it away.
Thank you. Thank you very much. It is really nice to be here and have the opportunity to talk to you about this low stress curbside service concept. My goal tonight is to try to give you a handful of simple, easy to implement tips that you can take back to your practice and hopefully use to make your life easier while still providing, the customer service and the patient care that I know you're all committed to providing. I know the issue is that this has been stressful, right? I don't think this past year has not been stressful for anyone. It changes the way you've had to do your practice. I get that. Not too long after the pandemic started, AVMA rolled out a survey and they found right away that 99% of veterinary practices had completely changed their operating strategy. 55% were already offering drive-through or drop-off services. 65% were using contactless payment, and 84% were doing what they called curbside. So clearly some people look at curbside and drive-through or drop-off a little bit differently. So you might say, for tonight, I'm talking about all of these things. Because we know, what I understand is that these appointments take you longer. I hear from the veterinarians I talk to that their phones are tied up, and it's harder for people to get in and out on their phone lines. Many, of course, are experiencing shortages of staff. I don't think that's really anything new, but maybe it's been worse this past year because you may have people out due to sickness or having to be in quarantine, or just for a variety of reasons, people may have had to move on at this in this past year based on what a spouse was doing, for example. But in light of all that, have we stopped, though, to think about how this has affected the pet parent and what this means for them? As we all know, a lot of people don't like change. Most people don't, or they find it difficult to deal with. And this is a big change for people. And just to kind of, I hope, send it home, let me share a story with you. I have a client, because I do still, see behavior cases. I have a client right now with a dog that I've been helping her with for more than a year, close to a year and a half probably. And it's a young dog within 2 or 3 years of age. But over the past year, she has had to take him to her regular veterinarian for a variety of different visits having to do with him shaking his ears, him licking his feet, chewing on his behind, or scooting. All of the things that I know we all immediately think of allergies when we hear, at least I hope we do. And that's really what is going on with this dog. He is demonstrating signs of atopy. But in all of this time that she has gone to this veterinarian over the last year, she has not once spoken with the veterinarian. She drives up, somebody comes and gets the dog, they take it in, they bring it back. The staff member that brings it back gives her bill and whatever medications they're sending home and talks to her. And she's starting to get very, very frustrated because she feels like she does not have the veterinarian's ear. And they may be giving wonderful care to this dog. In fact, it sounds like they are. I get his medical records as well. But it's the interaction that she is unhappy about, to the extent that she wants to change veterinarians. So I just want to remind everybody that our communication is more important than ever. Clients want to know what's going on. Studies tell us that clients want the veterinarian to give them direction. Even though I know they don't always follow our instructions, they do want to hear what we have to say. And I think this sort of interaction where the vets are not speaking to the clients as often, maybe they're phoning them later, but she hasn't gotten a phone call. So I know everybody does it differently, but this could really set us back. This takes us back to more of what I call a transactional type relationship, which is not the type of relationship that I think we want to have with our clients. And I know it's not the type of relationship our clients want to have with us. And all of that said, what about the pet in all of this? If we think this is not stressing the pet, then we have not stopped to look at it from their point of view. Because as a behaviorist, of course, this is always what I think about, right? What is the pet's emotional experience? What is the experience that they're having? How do they feel about it? And I can't help but imagine how an animal must feel when suddenly they have people coming out to the car at the veterinary clinic to get them. They're wearing masks or, possibly full PPE. I know, again, that depends on where you are. But the veterinary clinic was already scary for animals. And now we've completely changed their routine. And I can tell you, most animals don't like change in their routine either. So this image of people coming out to the car and, possibly sticking their heads into the car, I mean, they might as well be the equivalent of a big green monster, right? This is scary and different. And we need to be aware of that. Even if we're just wearing, a mask and covering part of our face and we're not, wearing the whole PPE, remember that eye contact is threatening to dogs and cats, it's threatening to most animals. And when we walk up to the car and we give them, direct eye contact, this is very new and scary for them, right? This is not the experience they're used to having at the veterinary clinic. And if you've gone out to cars to get animals and you've seen some variation on this theme, anywhere from, somewhat anxious and worried looking, like the dog on the left, to downright terrified, think they have to defend themselves on the right. And it reminds us, or should remind us, that how animals respond to a threat varies based on a lot of different things. And the reason I think this is really important is because over the last year, I've also heard a lot of people say that they think pets are less afraid now, that they're less difficult now that they're able to take them away from their pet owner. This is highly unlikely, right? In fact, fortunately, a couple of research groups have looked at this in the past year. One of them looked at it with cats and proved from the study that cats that were examined, separated from their owners, had higher heart rates and demonstrated more clinical signs of fear, anxiety, and stress. A similar study in dogs had a lot more data that's not easy to kind of share briefly, but it did demonstrate that dogs separated from their owner did a lot more lip licking than dogs that were examined with their owner. And lip licking is considered one of the most common signs of developing anxiety in a dog. So with all that in mind, let's talk about why we may think that these animals are doing better. If you're not aware of the 4Fs, that's what I want to introduce you to. Remember, I think most of us certainly learned about the concept of fight or flight when we were in vet school, or at some point. We know what fight or flight looks like. We know that that is a common state for animals to be in. And the dog on the left is demonstrating fight, and the little beagle puppy on the bottom is my flying dog. He's demonstrating fleeing. These two responses are very common when an animal feels highly threatened. And all animals have the ability to, experience these different forms of response. What we've forgotten about, or we've not been really talked too much about, are the other two F's, the freeze and the fidget, which are what you see on the right side of the screen. Freezing is a very common response for many different animals. And sadly for them, when they freeze, we say, that's good, right? They're fine. These are the animals we like because they let us do what we want to do to them. But again, the unfortunate thing is that animals in the veterinary clinic or in any threatening or scary situation are learning. And if they learn that even though we're afraid, they are afraid, that we don't do anything different, that we don't respond or respect their fear to some degree, then their behavior, their fear is just going to get worse, and their behavior may change the next time they are in a similar situation. And again, those are the things that we don't really think about, is the fact that animals are learning, and what dictates how any individual is going to respond in a situation where they feel threatened are a lot of different things. Okay, it's going to have to do with their experiences, what they've learned. It's also going to have to do to some degree with their genetics, and also how they perceive the threat. And we need to remember that different individuals perceive threats differently. And just to kind of wrap up and bring you back to the 4S, remember that the fidgeting includes the things like lip licking and yawning, suddenly stopping to scratch or lick at themselves. These are the signs that we often miss. I know our pet owners tend to miss them, and they don't realize that their pet is distressed. And we need to pay more attention to them. Because if you will, think of this, like my favorite analogy is to consider a smoking small ember compared to a blazing inferno, a big forest fire. And when animals are still just mildly anxious and they're just licking or fidgeting, this is the equivalent of the little smoking ember. And we would not ignore that, right? We know we don't ignore smoke. If we see smoke, we think fire, we do something, because we don't wait until we have a forest fire before we try to put it out. So think of these guys as your little smoking ember. When they are fidgeting or freezing, this is your opportunity to get in there and do something for them. Because if you wait until they are responding with this full out fight or flight situation, that's when it's much harder to do anything about them. That's what makes your life difficult, makes it hard for us to give them good care. And it gets harder and harder to change this, because we can help these dogs that are fighting and trying to flee, but it takes a lot of work. It's not easy. So what can we do? Let's first think about preparing the pet and the pet owner for the visit in such a way that when they get to us, they are not already in this fight or flight state. Maybe they're still either mildly anxious, or if we're lucky, not anxious at all. And there are things that we can do to increase the chance that happens. One of them is when your CSR, whoever you have, is calling your appointments or reminding people about their appointments. And I assume most people have some situation, some system of doing this, whether it's by phone calls or emails or whatever. The point is that that is the time when you can prepare the pet for the visit. You can ask the client how that pet has responded in the past. Ideally, you should have that in your record, and the person should have the pet record in front of them when they're making this call, so they can see, yes, this animal does better if he gets a dose of trazodone before he comes in, or as long as they're using pheromones or a nutraceutical. But that's the time when you want to talk to people and you want to prepare them and help them prepare their pet. And I know Fear Free has, or recommends at least, sort of a checklist of things like this that you can ask people about before the appointment. And again, save time during the appointment and get those animals in where they're not so stressed. So asking people to come in and pick up some pheromone, or go to the online store and pick up some pheromones and use them in the car before they come. Reminding them to bring their pet in hungry so that you can use treats, and even to bring their favorite treats. It's also a good time, especially if you want to try some of the things I'm going to recommend next, to remind your client if you would appreciate they wear a mask. Again, people are going to deal with change better when they are prepared. So don't let people drive up and not know what's getting ready to happen. You want to prepare them so they know exactly what's going to happen. And just as a little quick reminder here, I want to also point out that we have developed several different tools for you that we think can help you get information from your owners in a quicker, more efficient way and use it to the pet and to your benefit. One of them, for example, is a noise questionnaire. And again, this can be sent to the pet owner by email. It can be on your website and they can be directed to go to it. But this one and the separation anxiety one, for example, as well as many other useful things, are available at CevaConnect.com. And these are intended to help save you time by getting that information to the pet owner first so that they can fill it out, or maybe they fill it out while they're sitting in the car. But then it has very easy step-by-step instruction to help you and help the pet owner know how to help the pet with that particular behavior problem. So that's just one example of something that I think can help save you money or save you time, if you're really, really swamped and busy. Another example, again, is when your staff member is going out there to approach the car. There are good ways to do this, and there are not so good ways to do this. Ideally, they will be sprayed with pheromones. They may take a towel sprayed with Feelway out there, or a bandana sprayed with Adaptal, especially if the owner had not used pheromones in the car before their trip. This gives you one more opportunity to do something to help keep the anxiety down in that pet. This might be something you take to them if you have a CSR or technician that goes out there first and hands the pet owner a sign-in sheet, for example. They can give these things to them at that time. They come back when it's completed, and they've given the pet some time to get the benefit of that pheromone. Other things that you can also, or you should also think about, is how you approach that car. Because if you walk up to the car and stick your head in there, or you stare directly at that animal, again, we need to understand how incredibly threatening that is. So if you're going to get patients from the car, how you do it is really important. And the picture on the left, again, demonstrates just a really, really inappropriate approach to a dog. And this really goes for when your clients are coming back into your waiting rooms too, because I've seen veterinarians and technicians walk up to dogs and have this sort of demeanor, stare at them, bend over them, reach out, pet them on the top of the head. And all of this is incredibly threatening. Even if this is a dog and I'm probably like everybody else, I probably get a little bit complacent with animals that I know, or I feel like I know. We need to remember that it still increases their anxiety if we approach them this way. And obviously, it would be to everyone's benefit if we did not do anything to increase their anxiety. So more appropriate ways to approach them include standing to the side, looking at them from the corner of your eye a little bit, petting them on the side, not, again, bending over and reaching over their head. And this can be done when getting an animal from the car. This is not a bad example on the right, although again, obviously it's in a waiting area. But even here, I will point out that she is doing a little bit more direct eye contact than is entirely appropriate. But otherwise, this is a good example. In a perfect world, I would ask pet owners to get out and hand me the leash of their pet. I would absolutely not recommend that you or your staff, any of the veterinary staff, be the one to leash the dog or to put a bandana around its neck or anything like that. It is much better if the pet owner does that, because again, that can be a very threatening interaction for many dogs. So if you do have to reach in to get the leash, again, it should already be attached. You should remember to stand a little bit sideways. Keep the door narrowly closed if you're worried about the animal bolting out, and get that leash and then step away, again, without giving a lot of direct eye contact. And then use treats to get that animal into the building. Again, I've seen so many dogs drug into the clinic, and this is a video that this shows a dog being dragged into an exam room. And I want you to know she's standing in front of him, she's pulling him, and he is resisting. And this is a really typical response. He does better when she stands to the side. But look what happens if she keeps the leash loose and stands to the side and throws food in front of him. And this is a fun video because actually it shows that on the next visit, he responded better. But I want to use the video again just to remind you of how important it is that you not try to, walk in front of a dog and drag them into the clinic, that they need to be lured ideally with treats. And I just call that the little Hansel and Gretel trail of treats. And that's what I encourage people to do to get them into the clinic, because otherwise it's distressing for the pet owner. Again, it's increasing the dog's anxiety because you're forcing it into a situation that it finds threatening. So instead, change that to a situation that's pleasurable, and you can do that with food. Accepting the pet, if it is a small dog, for example, or a crate, again, I like everybody to think in terms of not reaching towards the pet owner and taking their little dog out of their arms, but standing to the side and letting the pet owner pass you the dog. You can, in some cases, even ask them to pass you the little dog with his behind first, so that you can tuck him under your arm and you're not necessarily greeting the biting end that way too. Also keep in mind that, again, crates should be covered. If the owner did not bring something with them, a towel sprayed with Feelway, for example, or something to cover the crate, then you should be going out there with something to cover that crate so that all of that stimuli outside is not further distressing this animal. And then handle that crate with care. I even did a virtual visit with a clinic the other day where I watched somebody carry a crate in by the handle. She's standing there talking to people, and the crate's, at an angle, leaning against her leg, and the cat's in there, scrabbling around because, it's being knocked around. So you really want to ideally take these crates from the pet owner in both hands, carry it in your arms like you would something that's precious, not like a picnic basket, swinging it on the way to grandma's, all right? My preferred alternative, if I could have my way, if I were in a busy clinic right now, this is what I would be doing, is asking people to be prepared to bring their pet to the front door. So maybe you instruct them to call when they arrive and tell them you will call them when you're ready. Your front door is locked, you're going to the front door, you're opening it just enough for them to pass a leash or a crate through to you. And again, as long as everybody's wearing masks, this is a much less distressing interaction for this dog than it would be if it was taken away from its owner at the car and taken into the clinic by someone's theory. The other thing you can do, or I remind you to do, is be sure that your room is prepared ahead of time. this is just a picture of an example from a fear-free clinic that I visited. I thought it was so clever. I wanted to show it with you, but they prepare their exam rooms using this little tray, and they put on this tray all of the things they expect to need for that particular visit. So it's ready to go. And true, there are going to be times when unexpected things come up, and you may have to send somebody out to get something. But most of the time, we have a pretty good idea of what we're going to need, and it's not that hard to go into the room with it ready to go, so that there isn't a lot of coming and going in the room or changes of people, you know, different. Ideally, the person that starts with the animal should be the person that works with them throughout. Every one of those changes can increase stress in the animal. And I've also seen another clinic virtually that was just, now that they're doing curbside, they're taking every animal back to the treatment area for their handling and not even doing it, not doing anything in their exam rooms. Please don't do that. Your treatment area in most cases, I know, is the noisiest, busiest, most chaotic place in the practice. There is absolutely no reason, and I urge you not to take animals back to the treatment instead of seeing them in a nice, quiet room where you can keep their anxiety down. The treatment area is virtually guaranteed to increase their anxiety. Don't forget that a part of keeping these exams low stress can also include having a variety of treats in there so that you are likely to have something that this animal will like. Remember, every animal's an individual, and what one finds very, very special, another one may not be interested in at all. And it is important that you have things that the animal will perceive as very high value. Certainly, if the owner sent those treats, that's a good start. But a lot of times owners have no concept of what is considered a high value treat to an animal. And so you need to be prepared with those things. And I give you some examples here. Things that are spreadable and lickable are great. A lot of animals will lick when they can't or they won't chew. And again, just having a variety of things that are considered very high value. For cats, it might be those, you know, dried bonita flakes. I know a lot of people have had success with those. For dogs, it might be, you know, having some chopped up deli meat, like turkey deli, very sliced up in very small pieces. Also remember that we are getting an increasing amount of data that tells us how valuable music is at keeping everyone calm. So just wanted to be sure aware of these. I think they're very, very clever. Not everybody's clinic is wired for sound. So these little through a dog's ear speakers, things that you can buy and put one in your exam room, and they can play this very calming music for your pet. So you might look into those. And of course, don't forget your non-slip surface. Whether you're seeing the patient up on the table or down on the floor, being sure that they're not slipping and sliding around is very important to their well-being. And I want to talk real quickly about pheromones because I want to be sure that you understand how they work, you know, what they are, and what you can expect from them. The thing is, pheromones can be a real easy button. This is something that's safe, that you can use on any animal. You don't have to worry about its age or health status. It's not a drug. You don't have to spend a lot of money adding new equipment to your clinic, or, you know, sending people out to workshops to learn new stuff. This is just about using a product on a regular basis in an effective manner in your clinic. And just to review, you know, for those of you that aren't aware of it, you know, olfactory communication or chemical communication, these are some of the most important ways that animals communicate, in particular, the dogs and cats that we are seeing in our practice. Chemical communication is critical to them. And those chemicals are divided into two different types, roughly. One of them is pheromones. Pheromones, by definition, are just a chemical that animals use to communicate that are species specific. Part of that definition with pheromones is that when one individual secretes a pheromone and another individual perceives it of the same species, it makes a change in that animal's behavior or physiology. Okay? So pheromones are very important means of communication for most animals. They differ from olfactory cues, which are another important form of communication, again, in the fact that they are species specific. And one of the reasons that's really important is that olfactory cues are something that are individual between every single animal out there. So this cat on the left and this cat on the right have different olfactory cues, but they share the same pheromone. And because olfactory cues are individual, animals use them and learn from them, and they learn to recognize individuals by their smell. But what that also means is that how an individual feels about an olfactory cue can be readily conditioned. They can learn to associate a smell with something pleasant or something unpleasant. So how they feel about it can change based on experience. And that is much less likely with pheromones. So pheromones are something where an animal is born with a response. They don't have to learn it in most situations. And they are born with the receptors for the pheromones of their species, and they will receive those. How it acts on them is going to vary due to all of those things we already talked about, right? The situation and how threatening they perceive it, what they've learned about the situation. Is it already considered an extremely threatening situation to them or not? All of those things play into how much you see the response. The other thing that's interesting about the difference between pheromones and smells is in how they are perceived. So smells are perceived through the olfactory epithelium of our nose, right? I think everybody knows that. But pheromones are perceived primarily through the lining or by the lining and receptors in the vomeronasal organ. And most all mammals have a vomeronasal organ. It's a little specialized organ that lies above the hard palate. And in dogs and cats, it opens into their mouth. And many animals have a behavior that they evolved that helps them increase the likelihood that they will get pheromone perception. In horses, this behavior is phlegmon. In cats and dogs, the behaviors are much more subtle, and I have one example. They vary a lot more in how they look. And this is just an example of a cat gaping, and it's called a gape response or a gape reflex. And it is what a cat does. If they smell something that's really interesting and they go in there, it basically motivates them to go in there and perceive more of those molecules. It's like, oh yeah, I want all of the information available to me there. So most pheromones do hang out, if you will, with smells. Horses are the same way. They smell something, they go in to investigate it further, and if it's really, really interesting, you will a lot of times see them perform the phlegmon response in an attempt to get more information. The other thing that has been discovered is that pheromones and smells take different routes to the brain, and that's what this is demonstrating. And without getting into a lot of detailed neurophysiology, basically, what we know is that when a pheromone triggers the vomeronasal organ to send a message up the vomeronasal nerve, it goes to the accessory olfactory bulb, as opposed to the main olfactory bulb, which is where your smell messages are going to go. From the accessory olfactory bulb, the messages are sent to the amygdala. And from there, the amygdala sends messages to the hypothalamus that just dictates what's going to happen next. But the amygdala is really, really important here because it is the site or it is the area of the brain where fear and many other emotions are processed and stored. And just to give you a little bit more of an interesting way to look at the amygdala, is these are two images. They're PET scans of gentlemen about the same age. The one on the left is a very famous rock climber. He's a guy that does lots of free climbing, lots of crazy, he takes on crazy things that most normal people would never consider doing. The guy on the right is also a rock climber, but he has not done or does not do many of the things that the fellow on the left does. The crosshairs of the image are directly over the site of the amygdala. And both of these men are being shown images, the same images that are considered threatening. They're scary pictures. And what you see in the fellow on the right is that his amygdala is lit up. It's active. It's sending messages to the cortex. But the image on the left of the guy that does so many amazing things, it's not lit up at all. His amygdala is not responding to a fear-provoking image the same way an average person would. Nothing happening here. So it demonstrates just how individuals perceive things differently, and I think it's something you want to remember with your patients. This is why you see such varying responses, is different animals perceive threats differently too. So the pheromones that are available to you from Ceva come in a couple of different categories, if you will. The first one are the appeasing pheromones. And appeasing pheromones are a type of pheromone that has been discovered in virtually every domestic animal now. They are pheromones that are secreted from specialized glands that lie between the mammary glands of these animals. And in all species, this particular pheromone begins being secreted about the time they have offspring and stops being secreted at about the time they wean their babies. So it is clearly something, again, to be conserved across species like that has a very important role in keeping the babies calm, possibly, and keeping them with their mom, maybe even encourages better milk consumption, better feeding behavior. But what we know from Adaptal studies, and again, Adaptal is just a copy of dog appeasing pheromone. We know from numerous studies that the Adaptal has the ability to decrease signs of anxiety in dogs in a lot of different circumstances in which they normally demonstrate anxiety. One of them being car travel, another one being in the veterinary clinic. Feelway multicat is feline appeasing pheromone, and it has been studied only in the context of inter-cat aggression and has been shown to help decrease conflict between cats in a household, okay? And so I'm not going to talk about that as much because I want to talk about what you can use in the clinic. So Adaptal, very useful for dogs in the clinic because it's this pheromone that's intended to appease, just like the name says. The Feelway Classic that I hope most of you are familiar with is a different pheromone from Feelway multicat. It is a fraction of a feline facial pheromone. It's called the F3 fraction. So it is one of the many compounds that are left behind when cats rub their face on things in the environment, like you see them doing here. And it has been shown to send a message that says, this is a safe place. This is my familiar place. And if you think about how often cats do this behavior of rubbing on things, and they usually do it when they are calm and relaxed, they are surrounding themselves with this chemical that probably contributes to helping them feel comfortable. It's like it's telling them, yes, this is my home, this is where I belong. And that's why it has been shown in many, many studies to help decrease signs of anxiety or distress in cats associated with being in strange or scary situations. So it's been shown to help decrease distress associated with car rides, distress associated with a veterinary clinic, moving, a lot of different things like that. Just a quick reminder, again, because I always get this question, can the pheromones, the Adaptal and the Feelway be used at the same time in the same space? Yes, because they are species-specific chemicals, we've had no reason yet to believe that, the dog can really perceive that cat chemical or vice versa. If they sense something is there, it doesn't mean anything to them because they don't have the receptors for that particular pheromone. If you're going to use pheromones in your clinic, which I encourage you to do, but also if you're going to sell them and you want to be able to talk to people about them, I want to mention this briefly because it is such an important issue because I see so many people make this mistake, especially pet owners. If you're going to use diffusers, they must be put on a wall where there is lots of space around them, okay, at least a couple of feet. If you put them behind a piece of furniture or under a cabinet, like you see over here on the right, it will not work as well because this is a heated vapor that rises into the room, and then as it cools, it falls down. And if it rises, if it's placed under a cabinet or behind a piece of furniture, it's going to rise and hit that surface, cool instantly, and condense out. And I have been into, unfortunately, many places, clinics and shelters and that sort of thing where I could see that the diffuser wasn't well placed, could go over there and rub my hand under that cabinet or on that piece of furniture and come back with this greasy residue. And that is where the pheromone is instead of out where it needs to be. This image here in the middle is an example of where somebody might ask, well, is that an okay place or not? I'm not sure. And I just encourage them to plug it in, and after a day or two, go in and check. Rub your hand along the side of that piece of furniture and see if you come back with that residue, and that will tell you, yes, that's a good place for a diffuser, or it's not. And believe it or not, many of the complaints that we get about the diffuser usually can be traced back to people putting them in an inappropriate location or putting them in upside down. So again, wanted to show you a picture. This is what a properly placed diffuser should look like, with the little vent up to the top because that's where the vapor comes out, and with nothing around it to block it. And again, just showing you sort of a nice situation. The dog's on his non-slip mat. He's got a food puzzle smeared with cheese. And if you haven't tried these different kinds of devices, Leaky Mats and these stick-on things, you really should, because they're usually grooved or nubby. They allow you to smear food on them in such a way that the animal has to work at them longer to get the food off. So in other words, if they're there for quite a while, or you're doing something to them that takes a few minutes, they're not having to eat an enormous amount of food while you handle them. A couple of other quick do's and don'ts about pheromones. Remember, if you can't use a diffuser, use the sprays. The sprays are equally as effective. Adaptal and Feelway Classic comes in a spray, and that spray lasts 4 to 5 hours. So in a typical veterinary clinic environment, I think this allows you for a very easy way to get into the habit of using them, right? You come in first thing in the morning, you spray yourself, you come back afternoon, after lunch, and you spray yourself again. And if your typical clinic open from, up until 6 or 7 at night, you're good to go. You can do the same thing with towels that you may want to use for handling, cages that you expect animals to be recovering from surgery in, and it keeps you from having to do it at the last minute and then wait for the alcohol to dissipate, because that's the other big challenge. Both of the sprays are alcohol-based, and you absolutely don't want to spray them on the animal, which I've known people to do. Please don't do that. You don't want to spray it in their face. You don't want to expose them to it until it has dried on the object you've sprayed it on and that alcohol smell has dissipated. After that, you're good to go. So I like my little Jack Russell face here on the left, because I think that's what he would look like if you put that bandana on him too soon while that alcohol smell was still strong. We know animals don't like that smell of alcohol. It is distressing. It is anything but calming. And the last comment I want to say about pheromones is, again, think back to my analogy of little smoking embers versus a big raging forest fire. This is the raging forest fire, okay? By the time a cat looks like this, you're past being able to use a lot of things, okay? This is at the point where you're almost going to have to sedate them. So don't wait to use pheromones. Don't think this is something you pull out because you have a difficult animal. This is something that should be there all the time, helping to decrease or prevent anxiety from rising. Okay? That's where you will get the most use out of it. And that's why ideally you would like people to apply it to their car or their crate before they even head to the clinic. But don't forget, when it's time to return the pet to the car, that you can do the same thing. You can be sure that the cat goes home with some kind of blanket or towel over its carrier if the owner didn't bring it. Send the dog home with a bandana, and tell the pet owner what you're doing, okay? You are going above and beyond to help this animal have a better veterinary visit. Then tell the pet owner. And again, on Ceva Connect, we have a nice little handout that you can use. On one side, it's dogs. On the other side, it's cats. So you can print them out that way. But the point is, you're letting the client know what you're doing to help their pet. And that means a lot to people. This is just an example of one that one of my fellow vet services managers created as an example. If you feel creative, do something of your own that you put your logo on, that you tell the pet owner what you're doing and what they can expect. And share your company's mission, your clinic's mission statement, or your values. Something, again, like this is going to help bond people to your practice. Kind of going back to the exam here, but for the pet owner's point of view, don't forget that if you have exam rooms that have windows that open outside, make use of those. Let the client know you are going to be over here, and if they want to go around and watch their pet's exam from the window, they can. And again, there are clinics that are doing this, and this helps the pet owner feel better, as long as there's not a lot of activity going outside, and that as long as the animal can't hear a lot of noise from out there, this will be much less distressing for the pet owner. And that matters. In the same way, also, I want to remind you again of all the technology out there that is now available that can help make these curbside appointments more efficient and, again, less stressful, especially for the pet owner. Be aware that, you can allow self-check-in through mobile devices. So these are ways we could use technology. That can save you several minutes. Allowing the pet owner to pay from a mobile device. This is what I mean when I talk about contactless payments. That technology is readily available. And again, it's going to save your staff a lot of time. If you are, one of these veterinarians that's calling the pet owners back after the visit. I know veterinarians that are staying in their practice for an extra hour at night just to get these phone calls made. Consider, again, a different way of doing it. Can you call the pet owner from the examination room, put them on speakerphone, and sit there and talk to them about what you are doing and what you are seeing? Again, this makes a lot better impression. You can do the same thing with, with FaceTime, with Zoom. There's a lot of different ways that you could communicate with a client during the appointment and help them feel a lot better about what they're getting for their money. Right now, clients are feeling very disconnected. And if you are in this situation where you're having trouble communicating with them, remember that poor communication will often result in poor compliance and just overall poor animal care, decreased client visits, and ultimately falling incomes. And I know none of us want that. So I hope that you will think about all of the different things that I talked about here, whether it be music or pheromones or how you handle that curbside drop-off. But pick one and try it for a couple of weeks and see if it doesn't make a difference for you. I know that it's hard to go back to your practice and make lots of changes at once. And a lot of times I've been the same way. You go to a conference, you get excited, you come back and you try to do all of these things, and then you get worn out and the excitement kind of wanes. So pick one thing, try it for a couple of weeks and see if it doesn't make things better. And if it does, then try another. But my point is, my take-home message is that your patients are just as afraid as they've always been. They just may be changing the way they respond to that fear. They need you, and the pet owner needs you, to be aware of this and try to change that if you want to give these animals good health care for the rest of their life, not just today at this moment while they're in your clinic, but for their entire life. And with that, I would be very happy to take your questions. And please make note, there's a reason I put my email address on here. I'm always available to you to help answer questions that I can about Ceva products or behavior. So let me know if I can help you with any of those.
Thank you, Dr. Tynes, for those great tips for minimizing stress with curbside visits. We do have a few questions from tonight's audience. We do have, so the first one here is, can you recommend the high value treat for kitties? Was there a specific recommendation you had for that?
Yeah, that's a great conversation because, again, you'll find lots of people out there using lots of different things. One of the things that I've heard is incredibly high value for most cats are those dried bonita flakes. But there's also a new product out there. I think they're called churros. I keep meaning to get a picture of one and add to my presentation because everybody's talking about them. And it's like almost like a canned or pasty kind of cat food that you squeeze up out of a tube. So it's very easy to give to cats. And again, it's very lickable. And that is proving to be very popular with a lot of cats. Whipping cream is the one I have had really good luck with. But I've had a lot of people tell me that they have cats that love that canned cheese. After that, I would think in terms of tuna fish. Just flat out open a can of tuna fish. But those are the types of things that are more likely to be considered high value by a cat.
It looks like most of the audience is agreeing with you there about the churro treats. Yeah. We have a lot of
those.
Those
are great. Yeah, fantastic.
The next question we have here is, are the pheromone sprays and diffusers safe for use around pregnant women?
Yes. There is nothing in either of those products that should be any kind of, provide any kind of concern for a pregnant woman. Yeah.
Perfect. And the next question here, could the Adaptal pheromone for dogs cause anxiety and stress in dog reactive, fearful, or aggressive dogs?
Oh, what a great question. I never say never, okay? Because again, how any dog responds is going to be affected by to some extent by their history, their learning experience. I've never had anyone report that. I usually hear that it's either inadequate to completely solve a problem, which again, not surprising, or they see nothing at all. So I'm not going to say it couldn't happen that some animals might respond that way, but it does go against what we know about how pheromones work. Again, that there's a receptor and that it triggers a certain response. It really shouldn't cause an animal that's fearful of dogs to respond differently to dogs in a more aggressive or anxious way. So it's a great question, though.
It looks like there's a follow-up question to that.
Yeah.
Are the Feelway and Adaptal sprays more effective if they're also being used at home in addition to being used in the vet clinic?
Again, we don't have the data one way or the other to say that. The only thing I would say is that, again, anxiety is always easier to keep down. And so for the same reason that, let's say if you're using gabapentin for your patients, you might ask the owner to give it the night before and then give it the morning of. And, maybe if there are appointments later in the day, you might give it again, right? You redose in order to get the best result. So from that point of view, if the animal is exposed to them before they head to the vet clinic, I think that can help because, again, their anxiety is maybe at a lower level than it normally would have been, which means that when it's greeted with the pheromone at the clinic, its anxiety is still lower. It's just not ratcheting up as quickly and readily as it otherwise would. So that's the only thing I can say about that.
And then another
Need
one
more data.
is, could the Feelway or Adaptal sprays become negatively associated with going to the vet?
That is, again, what I'm not doing a very good, I'm not explaining it very well since I get that question all the time, but that's kind of the point I was trying to make with olfactory messages compared to pheromone messages. It's not like we've studied that and tested it and proven it, but it goes against what we know of how pheromones work. So I just say it is not as likely that that would happen as it would that the animal will, respond negatively because it smelled bleach there before or pine sol or something like that. Does that make sense?
Yeah.
Okay.
All right. So switching to music here for a second. If unable to buy a music device for rooms, are there suggestions for music playlists that could be played off of like other devices like phones during the exam?
Sure, that's a great idea. And yes, the most important, what we really know right now is that it just needs to be calming music. So classical music, as long as it's not, the Beethoven's Fifth or something, the 1812 Overture, probably wouldn't be a good example. So music that is quiet and calming is really what we can say about that.
All right. The next question.
Oh, okay, go ahead.
Sorry, I'm just scrolling through. We have a lot of questions here.
Okay. Yeah,
I'm trying to get to
did,
all of
and
them.
I'm looking at them too. So,
how many pumps of the Feelway or Adaptal should be used in each room to be effective?
Fantastic. So, you're going to use the spray. The instructions are to spray about 8 sprays at any time. And it has been shown if you 1 or 2 sprays probably aren't going to do it. You do have to use enough of a dose that we know that, the animal's going to perceive it. And again, it's not a spray to be sprayed, in the air or anything like that. You spray it on the exam table. You could spray it on the towels, towels that you're going to handle the animal with. You can spray it on the inside of cages, bedding, that sort of thing. And always about 8 pumps is what is considered a dose.
All right. Is there any plans to have a pheromone wipe, like an Adaptal or a pheromone wipe?
There is the Feelway wipe, but unfortunately, the Adaptal wipes were discontinued because we just didn't get much use. So I see no chance of the Adaptal wipe coming back. But again, there are Feelway wipes, and that's a good little value added kind of thing you could do. I mean, those cost less than $1 a wipe. You could send one home with every cat client, or mail them to them with a letter reminding them it's time to come in for their annual visit, whatever. Those can be very, very useful. But no Adaptal wipes, sorry.
All right, next question here is advice for getting dogs back into the building after taking them out to the bathroom. Sometimes when the dogs are in the clinic all day, then they take them out. They have a hard time getting back inside because they want to run to the cars to find their parents.
Yes. Oh, and the same thing. You really, really need to have treats. In a perfect world, every technician would be walking around with a treat bag on their belt so that you always have something. Obviously, you may have to change them up a little bit if you're, dealing with an allergic pet, but the best way to do that is with treats. Because yes, the animal thinks they're going outside, they must be going home.
All right, next question. This person says they have clients trying to use pheromones in the yard to improve house training or entice the dog into the yard. Does this make any sense based on how pheromones work?
No, not that I can think of. No, there are a lot of other things I would tell them about house training if that's their issue. Unless the dog is experiencing some kind of fear or anxiety associated with where it has to eliminate, I don't see a role.
All right, we have a couple more questions here that are kind of along the similar line of questioning, so I'm going to group them together. Suggestions for patients that won't come into the clinic regardless of the owner walking to the door and they don't accept treats, or suggestions when dogs have too high of FAS to even get them out of the car at all.
Yes, absolutely. I mean, this is where we have to have real fear-free discussions, right? I always start this conversation by saying, I can't tell you how to practice, okay? But amongst the management or ownership of the clinic, you must determine, or I suggest you determine, what your limitations are going to be. What will you do? Because at some point, we all know, well, you could just pick those animals up and just force them to do what you want them to do, right? But if you care about how they experience this visit and how they are going to respond next time they come back, this is when you should have a really good conversation with the pet owner. And the types of questions I might ask is, first of all, is this treat that we're giving the dog a treat that it would normally take? We don't want to sit there, offering the dog peanut butter and then find out from the owner later, oh, he never eats peanut butter, right? So you have to know, is this something the dog would normally eat? And understand that if a dog will not take treats, then that means their FAS score is pretty high, in my opinion, especially if they are then also too afraid to come with you, or, certainly if they growl or snarl because you try to get them out. So if appropriate body language and, gentle, quiet encouragement and treats don't work, to me, that is a dog that needs to go home and come back on medication. And again, that's the whole longer discussion as far as what medication and how you do it. But I would, recommend the owner come back having had the dog on something like, giving it trazodone before the visit or gabapentin. And if that doesn't do it, then you try again with a higher dose. If none of those things do it and you absolutely have to, do you talk to the owner about coming out and just giving that dog a quick jab of some dexmedetomidine, something to completely knock it out? Because many of these animals, unless the owner is going to commit to the training and they have time to commit, in other words, the dog's not there for something, acute illness or critical care, are they going to invest in the training that can be done to change how that animal feels about the visit? So all of these animals can be desensitized and counter-conditioned to veterinary procedures. But it takes work, it takes time, and so it's going to take owner commitment. And that's your other option. I know I jumped around there a little bit, but hopefully that was that gives you some ideas.
That was a great answer.
Those are challenging. Yeah.
I really like this next question. For bringing in 2 pets from the same household during curbside, do you think it would cause more anxiety to bring them together, or would it be better to separate them out one at a time?
Great question. I would say it depends a lot on the relationship between those 2 animals. So let's say it's 2 dogs. Many dogs that have anxiety and have lived with another dog for a long time, they use that dog as social support. We see this all the time, that they are better when they're with that dog as opposed to when they're separated. And so you kind of have to ask the owner, I guess, how, what kind of relationship those dogs have and what they think. True, not all owners have the savviest understanding of behavior, but they usually observe their pet's behavior pretty well. And you can find out that, yes, this dog doesn't want to go anywhere without his friend, or no, sometimes, they have some conflict, in which case you might want to take them separately so that you don't have to worry about handling, 2 dogs that may be, resisting going into the clinic. It may be easier to handle one so you can give it all your attention. That's the way I would think about it.
All right, and we are back to pheromone questions. Are the pheromones safe to be left in the outlets overnight?
Yes. There is a lot of kind of, urban myths out there about the pheromones. The diffusers, there's no evidence that any diffuser has ever caused a fire. When diffusers become old, so I like to remind everybody that those diffusers are supposed to be replaced every 3 to 6 months. A lot of people don't realize that. When they get really, really old, they can begin to smoke and stink. They'll burn. But there's no, at that point you replace it. There should be no reason to be afraid of leaving these plugged in at night. And if you ever have a problem, please let us know.
All right. How long after spraying does the alcohol smell disappear?
That really varies, I find, with the environment. So, I can spray it on a towel and sit there and kind of wave that towel around outside, and it'll be gone in a matter of minutes. If you just spray it on something and lay it there, and if the environment's very humid, it may be that smell will linger longer. So I find some variation. It should absolutely be gone regardless. It should be gone in 10 to 15 minutes. But I don't find it usually takes that long. That's one of the reasons I encourage people to, come in the morning, look at your schedule and spray the items you think you'll need, right? We're going to do, 4 spays on dogs. So we're going to, have 4 cages sprayed with Adaptal, that sort of thing. Just prepare ahead of time so you don't have to worry about that.
Thoughts on using the Adaptal collar versus the Adaptal spray?
I personally love the collar, and that kind of gets into a whole nother discussion because we have a really great study that demonstrates how those collars can be very, very helpful in young puppies that are being socialized. It can help decrease the chance that they develop into dogs with a lot of fears and anxieties. So I love the collar, and I actually wish every puppy would wear a collar every month for the first 2 or 3 months of its life, or first 2 or 3 months in its new home, you know. If a dog has a lot of, you know, anxiety related issues and the veterinary clinic is just one of them, then I would urge clients to have a collar on that dog all the time, just because it goes everywhere with the dog. It's there all the time to help the dog rather than just, you know, periodically. So it definitely has a role. You can just get clients to, you know, invest in them, and remember that they have to be kept snug and that they have to be replaced every 4 weeks.
Are there peer-reviewed research studies that show effectiveness of Adaptal?
Several. And we have an entire book of them. And I can, oh yeah, I saw somebody else asking about some citations. Oh, for the study that showed the cats were more afraid when separated from their owners. I don't know what's the best way to get people some of these things, but yeah, they're out there. If you know who your Ceva rep is, they can get them for you. If you want to write down my email address and let me know that you would like some, I can send them to you. Just, yeah, there's a lot of stuff there. It might be nice if you honed in on which you wanted, because there's at least a dozen for Adaptal. So.
Going along those same lines, you referenced several printouts you said were available on the Ceva site. Can you direct our listeners to where they could find those?
Yeah, so go to the Ceva Connect and look at the library, and you will see the particular handouts I mentioned. But I also urge you to go in there and look at clinic tools, so that if you do much social media, there's all kinds of stuff in there you can use to help promote, you know, the use of the pheromones to your clients. There's a lot of tools in there that we continue to add new things to that. So, you know, keep an eye on it. It's there for you. No charge. You don't have to sign in with your Ceva ID to use it. There for your help.
What a great resource to have for everyone. Another question on Adaptal. If you're spraying it on the exam tables and then disinfecting between appointments, does that defeat the purpose?
Yes, in that case, you would have to retreat. So that is one place where if you want to spray them, which is a great idea, just know that you need to disinfect it and then follow up with Adaptal after your disinfectant has dried. That's why I like towels. Of course, I like to do towel handling with cats and little dogs anyway. So always having a towel there is an easy way to get that pheromone in front of them.
Which people within the clinic do you recommend be sprayed with pheromones?
Everybody that's going to handle an animal. You know, if you have to go and get an animal out of a car, if you have to restrain an animal, it would probably benefit you to spray. And what a lot of people do is they spray, you know, you might spray Adaptal on both your top and your bottom, but spray Feelway just on your shirt, because that's usually where you're going to be interacting with a cat, right? Sort of at waist level. Dogs, they're going to come up and investigate your pants a lot of times. So having it on your pants is very helpful.
Is there any issues with pets being allergic to any of the substances in the pheromone spray?
That's a great question. I have not seen that or heard of that. Again, the worst thing that I ever heard of was the client that sprayed Feelway on her cat and it had an asthma attack. You know, the Feelway didn't cause the asthma, the cat had asthma, and so spraying it like that, caused it to have an attack. The collars are a type of plastic, right? So there is an occasional report of a dog having an allergic response to that collar. So I absolutely tell people if your dog's ever, had an allergic response to a collar in the past, you might just want to watch it really carefully, because they're all made of, different base compounds. But anyway, I've seen a few that would get sort of a red erythematous, and even I think broke out kind of around their neck from a collar. So just, tell people anybody can be allergic to anything.
All right, we have somebody here from a large urgent care practice who wants some suggestions on best practices when you have a lot of animals kenneled in the same room. They do have cats in a separate room, but there's still multiple cats in the same room.
Yeah. I think the most important thing you can do, and I know this isn't always possible if you're already in a big clinic, right? But if the cages are not facing each other, that's huge. But if they are facing each other, then I would recommend, putting something over everyone, just putting a towel or a blanket over every cage so that the animals can't see each other. On the other hand, I will say I was in a fear-free clinic once that had done something I thought was incredibly creative. It was an older clinic. So again, the cages were in the room on both sides of the room, right? That's the way we used to design clinics. But they put a shower curtain type of thing, or it was a drapery, I guess. They made a drape and hung it down the middle of the room. And it, they could pull it back and forth on, I think, some kind of little rollers they put up there. And then, of course, there are also commercial devices like that you can buy, like they use in hospitals, the curtains they pull between patients. But this was great. This was like a nice little homemade curtain, and they could pull it between the cages so the animals couldn't see each other. So stopping the visual is a nice first start. Ideally, you would like to stop a lot of that auditory stimuli as well. Dogs in particular, when they are barking, are stressing everybody. The dog that's barking chronically is barking because it's stressed, and then it's causing all the other dogs to be stressed. Be aware, there's a nice study came out of the UK that showed that Adaptal in kennels, and this was a shelter, but it decreased barking significantly in the shelter. So trying Adaptal in the room, if it's a dog room with a lot of dogs, can also help. So you just want to think in terms of decreasing all the other stimuli that you possibly can. Everybody keeping their voices down, can be helpful in a busy treatment area. People, I think, get loud without really realizing how loud they're getting. So keeping your voices down, covering those cages with something, all of those things can help.
Some great tips there. Next question, can you use the pheromone sprays in an oxygen chamber?
Oh, that is actually the first time anybody's ever asked me that. I think I would not be afraid to spray it on a towel or a blanket, on bedding, and as long as it's dry, and then you put it in there. I would probably want to ask somebody higher up than me in Ceva about what the impact of spraying it in an actual oxygen chamber might be. That's a really good question. Right. I would say as long as it's sprayed on bedding and dried before you put it in there, that would probably be okay.
Suggestions for alternative options for clients that want to choose a more natural form of sedation.
Well, there's, two products out there that I like because of the data behind the molecules. One of them is the alpha-casozepine, which is in Zilkene. And the other one is L-theanine, which you can find in Angstitane. again, they are products similar to pheromones that you may have to double up. You might want to use, a double dose and use a pheromone at the same time. You could even use both of those supplements because they each work differently. They each kind of work on different neurotransmitters. And because they're, very safe, I've never heard of anybody having a response to them. If anything, again, they won't be enough to completely calm a dog. But if that's where you need to start because a client is hesitant, then I would absolutely do that and make those recommendations. But those are the two ingredients that have a lot of data behind them that show they have the ability to decrease signs of anxiety.
Are there long-term?
Sorry, I was just going to say they might also be the types of products that you would want to give maybe a day or two before a planned visit if the pet owner could do that. Go ahead.
Yeah. Long-term concerns with using trazodone and gabapentin long-term.
Well, I would say, again, there's limited amount of data on the use of trazodone in animals long-term. I would not have a problem with it. I think what's important is the dose. And I think there's a big difference between giving an animal a whopping big dose of trazodone for a vet visit a few times a year and giving it a whopping big dose, every day for an ongoing behavior problem. Those would be definitely two different scenarios. But personally, I do not have any concern with long-term use of gabapentin. I know too many people and animals that have been on it long-term for, pain-related or neuropathic pain and that sort of thing. I always recommend that if you have an animal that has to be on behavior medication long-term, that you do routine blood work on it. In a perfect world, I would like routine blood work, at least it's within, not more than 3 months or 4 months old on a patient that I'm going to start on regular medication. And then again, ideally in 6 months, maybe check, and then once a year, check their blood work if they're going to be on stuff long-term.
For curbside service, would you recommend waiting to bring the animal in until the doctor is ready to see the pet?
Absolutely. I think that's one. Well, again, now that I think about that, it might depend on the pet and how well you already know this pet. So some pets, if one person, let's say a technician takes them into the room and plays with them a little bit, it gives them treats, it gives them time to calm down, then some animals may calm. Cats, for example, will sometimes take some time to calm down. You put them in a dark room, cover them up with a pheromone spray towel and leave them for 10, 15 minutes if you can. And I know a lot of people have good results with that. But I would say for most dogs, I think that their anxiety is probably climbing if they're having to just wait there. So again, if somebody can play with them and, play tug or ball, again, depends on how well you know this patient and what he likes. Clients can bring favorite toys too. It doesn't have to be limited to treats. Sometimes dogs can be distracted with a little bit of play and some basic training, sit, get a treat, come, get a treat, just kind of that sort of thing in the room could help distract them. But I would be careful about making them wait too long.
Is the solution in the diffusers different than the solution in the sprays?
Yes, it is. So the solution that's in the diffusers is specifically designed to heat and vaporize. It's some sort of solvent type of thing, I think. I forget exactly what that base is, but it is very different from the alcohol-based sprays. Again, the alcohol-based sprays are expected to be on a fabric, right, or something like that, and dry and be effective. The diffuser, it's heating that liquid and turning it into a vapor. So they are different.
Great. Okay. Still have a couple. We do have.
Okay, go ahead. That's fine. How do you properly pronounce Duxo is what I say. But I have actually heard some people say Duoxo. I promise you nobody's going to laugh at you one way or the other.
Does Ceva have bandanas available?
We normally do, and they are something that you can get when you order certain amounts of product sometimes. Again, you might ask your Ceva rep if they can get them for you. It's going to depend on how much product you order. And if you don't know who your Ceva rep is, again, feel free to reach out to me or call the 800 number on one of the boxes or bottles if you have one.
All right, I saw one question come through on the chat. Can you explain the difference between Feelway and Feelway Multicat?
Yes, happy to do that because it's still a question for a lot of people. So again, Feelway Multicat is a copy of cat appeasing pheromone. It comes from specialized glands that lie between the mammary glands, and it is believed to be a generally appeasing pheromone. The only studies we've done with it, though, because it's only been around for about 4 or 5 years now, have been looking at it in multi-cat households. And so it's shown to decrease conflict amongst cats. The Feelway Classic is a copy of the facial pheromone that, again, has been shown to help cats feel better about where they are. So the way I try to explain it is I think of Feelway Multicat as being for social situations, when you need social calming, and the Feelway Classic where you need the animal to feel better about where it is. So it's about place. And hopefully that helps. And we have, again, on Ceva Connect, there's a really cool chart that you can download that shows you the recommendations for when and how to use all the different products. It even gives you examples for when, like a Adaptal collar might be used as opposed to Adaptal spray. And it does that for all the Feelway products too. So it's pretty handy. One of the favorites that people have, that's why it got put on the on the site. So people can download it at their whim.
All right, the last question we're going to take tonight because we're running out of time. This is to recap something that you had mentioned earlier. You mentioned the diffuser should be replaced every 3 to 6 months. Is that the solution refill or the actual plug that goes into the wall?
That is the actual plug, because the solution refill lasts up to 30 days. Okay, so about 28 to 30 days is how long you expect the bottle of solution last. Just like the collars last a month, the bottles last about a month, but it's the plug that needs to be, I've met people who've had them for years and they're all, burnt and icky looking. And I'd be kind of nervous about that at that point too.
All right. Well, that is all the time we have for tonight. Dr. Tynes, was so nice for you to leave up your email address for any additional questions that we weren't able to take tonight. Thank you so much for that. And thank you to Ceva Animal Health for being our sponsor. And thank you to all of you for spending your evening with us. You will be able to find a recording of this webinar on fearfreepets.com within the next week. You guys will also get a follow-up email with Dr. Tynes' top 5 tips for curbside service, as well as a link to a recent blog post on curbside service, also sponsored by Ceva. So thank you guys so much again for spending some time with us here tonight. It was great to have you all, and we look forward to having you guys attend our webinars in the future. Take care and have a great night.
Thank you from me as well. Good evening.